Thank you very much indeed, Madam Deputy Speaker. And can I apologise straight away? I did alert the Speaker earlier to this, but I have a long-standing engagement at the University of East Anglia this evening, and I hope it will be okay with the front benches if I'm missing from the end of the debate. Madam Deputy Speaker, I agreed with an awful lot of what the last speaker spoke about in this debate, other than the fact that it is the role of the Labour Party to confront the issues set out in this budget. But I wanted to focus my remarks today on the contents of this budget that relate to social care and to the health service. And I wanted to start by just making the very clear point that the £1 billion announcement for social care for the next financial year is wholly inadequate for the needs of the social care system and for the people who rely on it. And I say that because the Health Foundation has been very clear that the current gap in social care is estimated to be something in the region of £2 billion a year. And that is in part because of the impact of the increase in the national minimum wage, which will cost the social care system in the next financial year something in the region of £900 million. So this means no real terms increase in the amount of money available to the system. And as the Care Quality Commission recently confirmed, not politicians but the regulator in this country, the social care system is close to tipping point. There are very many providers who are now looking at whether they want to withdraw from the publicly funded market of social care in this country. There are other providers that are at risk of going out of business. A very alarming fact is that in the north of England, there is very little, if any, investment in new social care facilities because the finances simply do not stack up. The only parts of the country where investment in new social care facilities makes sense is where they can cross-subsidise from wealthy self-funders paying for the provision of care for those who rely on the state. And so we are seeing and witnessing an increasing divide across our country in the quality of our social care. And for me, this is simply unacceptable. There are now estimated to be over 1 million older people who have care needs, but whose care needs are not being met, either in whole or in part, as a result of the reductions in the availability of publicly funded social care. That is disastrous for those people, but it's also very stupid because it inevitably means that more older people next financial year from this April will end up unnecessarily in hospital because they don't have the care package available to them that can keep them in good health at home. More people unnecessarily in hospital means more pressure on the NHS. And we have seen over the last 5 or 6 years considerable increases in income for acute hospitals within the NHS, but demand has increased even more because of the inadequacies of the social care system. This is a sense that you're left with a sense of lurching from one crisis to another, and it seems to me that there must be a better approach. Now, the government says that there will now be a green paper to address the issue of funding of social care. But you go back to 1999, when the previous Labour government set up a royal commission into this very subject. This is an issue that has been put into the long grass now for far too long. Under the coalition, we actually went out and sought the advice of a leading expert, Andrew Dilnot. We got his advice, we consulted on it, and we implemented in legislation through the Care Act the cap on care costs, which would have introduced greater fairness into the funding of social care. The Conservative government, or the Conservative Party in their manifesto, committed to introducing the cap on care costs. And then as soon as they were re-elected, within weeks of that re-election, they abandoned that commitment, just as they are now abandoning the commitment not to increase tax. They said that it would be delayed until 2020, but no one at all believes that it will be introduced in 2020. It's quite clearly been abandoned. So a green paper, a discussion document, is not what is needed. There needs to be a much greater sense of urgency. And then so far as the NHS is concerned, well, we're told that there is a £325 million boost to capital spending. But in this financial year, capital spending has been cut by £1.2 billion, raided in order to fund the clearing of deficits. And with this £325 million, only, we are told, between 6 and 10 pioneer sustainability and transformation plan areas will benefit from this funding, which means that the whole of the rest of the country gets no increase in capital investment at all. And the Health Service Journal has indicated that there is likely to be another raid on the capital budgets in the next financial year, making the situation even worse for the rest of the country. Now, in the referendum campaign, those advocating Brexit argued that leaving would give this country £350 million per week to spend on the NHS. Well, this budget offers this country, instead of £350 million a week, £2.7 million per week in capital funding, a wholly inadequate figure. And then we look at the provider deficits around the country. They stand at the end of Q3 at the figure of £886 million, and that's after the injection of £1.8 billion to clear deficits from last year. And the Institute for Government has today confirmed that 90% of hospitals in this country face deficits. It is now endemic across the system. So this budget, it seems to me, is inadequate for social care, but actually disastrous for the NHS. There will be a 1% increase in funding for the NHS for 2017-18, but that compares to an increase in demand of about 4%. And the next financial year, there will be a reduction in spend per head in real terms on the NHS. Now, wherever you are on the political spectrum, that makes absolutely no sense at all. At a time when demand is rising rapidly, to be reducing spending per head on healthcare in this country is nonsensical. And it amounts to a reduction in the percentage of our national income that we are choosing to spend on health and on social care. And I just wanted to focus for...
brings a lot of experience from his time in office, and I believe that before the budget his party was advocating £2 billion of immediate spending on adult social care and £2 billion of immediate spending on the NHS. £4 billion, a lot of money, and I've no doubt he has arguments for why that amount of money is needed, but could he enlighten us as to how that money will be raised?
We have our spring conference coming up, and we will be coming up with some proposals in that regard. But it is, well, I'm being asked to enlighten the House. And
to invite him to your conference?
Well, I would be delighted to invite the honourable member to our conference. I'm sure he would have a wonderful, fine time. But he will find out more very soon about what our proposals are. But in a sense, taking up the challenge from him, I share his view that we have to be responsible in how we argue for how spending should be paid for. And we intend to be fully responsible in that regard. And I hope that reassures him, and he will find out more details very soon. But I wanted to focus, Madam Deputy Speaker, for a moment on what the consequences for ordinary people are of the state of our NHS and our care system. Now, the honourable gentleman has talked a lot about support for people with long-term conditions. The NHS is now having to cope with a dramatic increase in the number of people living with long-term chronic conditions. They estimate that the increase in the number of people living with 3 or more conditions will increase by 50% over a 10-year period. So this is something that we're witnessing now, which is completely unprecedented. But the failure to meet the care needs of those people have disastrous consequences for many of those individuals. And it was just in the last few weeks that I took up the case for an individual in my constituency, an adult who suffers from ADHD. And he's been referred by his GP to the adult ADHD clinic. And so I wrote to the Mental Health Trust to ask what the waiting time was for his treatment. And I was told in response that the current waiting time in Norfolk for the ADHD clinic is 2 years. 2 years. Now, what on earth is that individual supposed to do in the meantime? There is, I'm afraid, still a complete inequality of access to treatment between mental health and physical health. It's a discrimination at the heart of the NHS, and we will never address that discrimination with the levels of inadequate funding that we are experiencing at the moment. I have a 9-year-old boy in my constituency who has been referred for diagnosis for possible autism. That family was told that the waiting time for diagnosis for autism is up to 3 years. 3 years. Now, I just assumed that there was something appalling happening in Norfolk, but when I went to the National Autistic Society to ask for more information about what the situation was across the country, I was told that this is very much the case across the entire country. What are we doing to our children? These are children we know that with early help we could make a massive difference to their life chances, and yet we are telling them that they are supposed to wait 2 to 3 years for a diagnosis, let alone any treatment. This is scandalous, and we are letting down some of the most vulnerable people in our country. And the really awful thing is this, that if you have money, you can circumvent these awful waiting times. You could get a diagnosis for autism. You could get help for your son or your daughter. But if you don't have money, you are just left waiting. And that is unjust and it's unacceptable, but it's what's happening in this country. I give way.
I'm very grateful for him to giving way. I mean, not only is it a grave injustice on these young people, it's also hugely costly to the taxpayer, because if you fail young people in their formative years and fail to break down the barriers that prevent them from getting a good education, what happens in the longer term? We pay more in terms of unemployment and the costs of further mental ill health and breakdown of social life later on.
Well, I totally agree with him. It's an absolute false economy. We know that 75% of mental ill health starts before the age of 18. Now, under the coalition, we secured £1.25 billion over a 5-year period in the final budget for children and young people's mental health. And yet the Young Minds survey just before Christmas shows that in 50% of CCG areas, the money, not all of the money, is getting through to be spent on children's mental health because it's being diverted to other parts of the NHS that are under impossible strain. This is scandalous. And it's outrageous that children with mental ill health are being let down in this way. I give way.
Thank you, Madam Deputy Speaker, and I thank the Right Honourable Gentleman for allowing me to intervene on him. I have some experience of autism, and not me personally, but in my family, and I have always thought that it doesn't take very much to diagnose autism. It's not a costly affair, and it can be done quite quickly. So I don't quite understand a 3-year waiting list, but perhaps the Right Honourable Gentleman has more experience than me on this.
I'm very grateful, and he's right. Through in part better organisation, we could help to sort this problem. But I've had an 11-year-old girl in my constituency referred to the Mental Health Trust, and instead of the mental health team having people trained in the diagnosis of autism, she's been referred to another trust to go onto a waiting list for a diagnosis. This is hopeless, a sort of siloed mentality within the NHS. So in part it's a failure to invest sufficiently in those good diagnostic services, but in part it's a failure of organisation as well. But just some other examples of this extent to which this system is now under impossible pressure. 197,100 delayed days. These are delayed discharges in January of this year, up 23% from January of last year. The delays in mental health of discharge are even worse, up 56% in the number of bed days lost through delayed discharges in the year to October 2016. With regard to ambulances coming to collect people who are sometimes acutely ill with their lives at risk, there is a target for responding. 75% of those cases where the person's life is at risk should be responded to within 8 minutes. And yet that target has been missed since May 2015. That's 20 months. In stroke care, we all know that your chances of survival, your chances of avoiding long-term disability depend on you getting to a specialist unit within 60 minutes. It's called the golden hour. Well, in the last year, in my constituency, 18% of stroke patients got to the specialist unit within that golden hour. That is, again, a scandalous failure of a health system in this day and age. And in A&E, 85% of patients attending A&E seen within 4 hours of January, way below the standard national target of 95%. And in cancer services, treatment starting within 62 days of referral, now the target being missed in too many cases. It should be 85% being met within 62 days. It was down to 79.7% of patients. And this leads to a real concern that I have, because if you have yourself or a loved one suspected cancer, and you are worried about whether you are going to be seen on time, whether you will start your treatment on time, if you have money, you will choose to opt out of these waiting times. You will get treatment privately. And when we talk about privatisation, I think a debate that often takes us down a ridiculous cul-de-sac. The actual privatisation that is happening is that increasing numbers of people with money are choosing to opt out of long waiting times, and they are getting their treatment privately. Now, I find that intolerable and insidious, because it means that people with money will get access to treatment quickly, and people who don't have the money will be left waiting. I think that, Madam Deputy Speaker, is intolerable. And the government, or the NHS England, has now established the process of sustainability and transformation plans. Well, the King's Fund takes the view that without heroic assumptions about efficiency savings between now and 2020, in each of the footprints of the STPs, they are likely to be hundreds of millions of pounds short of the money required. These STPs, a good process, a sensible process for bringing health and social care together, are based, sadly, on a fantasy of simply insufficient resources being available. And with all of those examples of what I've given to the House, it seems to me that failures of care are now becoming endemic across the system, and that is in stark contrast with the Secretary of State's commitment to make the NHS the safest healthcare system in the world. It is impossible to achieve that, given the extent to which failures of care are now becoming commonplace. And, Madam Deputy Speaker, there is an alternative to this sense of a government lurching from crisis to crisis, using sticking plasters to avert total collapse in the system. The approach that the government should be taking is to be prepared to work with others, as has been indicated, including by the previous speaker, to work with others to come up with a long-term sustainable settlement. The NHS and the care system was designed in the 1940s at a time when the needs of this country were wholly different to what they are today. The need for the whole approach to be refreshed, it seems to me, is overwhelming. Now, I got together a group of Conservative MPs, a group of Labour MPs and Liberal Democrats to make the case to the Prime Minister for establishing an NHS and care convention to engage with the public and with staff in the NHS and the care system, so that we can have a mature debate in this country about how we achieve a sustainable, efficient and effective health and care system to meet the needs of our loved ones in their hour of need. Now, the Prime Minister has met with us and she has sanctioned the start of a dialogue about what we are proposing. We are due to meet with the Prime Minister's health advisor, James Kent, and I welcome that. But the fact that the government has now announced a green paper for social care, continuing this siloed mentality of looking at one side of the divide or the other side, leaves me with the sense that the government does not appear to be wholly serious about engaging with this group of MPs on what I think is absolutely necessary. The truth is that partisan politics has failed to come up with a solution for the needs of this country in terms of its health and care system. And that's in part because all of the solutions are actually rather difficult, as the honourable gentleman indicated from opposite. It probably involves us all being prepared to pay a bit more tax to ensure that we have a health and care system that we can rely on and be confident that it will respond in our hour of need.
Thank you, Madam Deputy Speaker. I thank the Right Honourable Gentleman for giving way. The Right Honourable Gentleman's group of MPs from across the House, are they looking at other sort of models like the German model of how they provide health care on their equivalent of NHS, which is a combination of private and national means? Because this seems to be something we're going to have to seriously consider in order to get a really first-class National Health Service.
Well, I thank the honourable member for that intervention, and the interesting thing is that the Germans spend about a third more than we do on their health system, and they have an effective health and care system as a result of that. What we have done at the moment, and I would invite the honourable gentleman to join with us on this, what we've done at the moment is that we all acknowledge that this is difficult, that it involves acute politics, that there is an enormous risk of people just shouting at each other, and instead of that we have come together to say let's opt for a more rational approach where we all agree that we should be bound into a process lasting perhaps up to a year, where we engage with the public on the sort of debate that he raises there. Let's have an open discussion about how we sustain the health and care system. I want to ensure that whatever emerges from that is a system which is accessible to anyone in this country, irrespective of their ability to pay. That was the founding principle of the NHS, and it remains true, it seems to me, to this day. Now, along with advocating the case for parties working together to resolve this intractable problem, my party, the Liberal Democrats, are continuing to do our work on developing our own ideas. And I established last autumn an expert panel, an independent expert panel, to look specifically at the case for a dedicated, a hypothecated NHS and care tax. And I was fascinated that in yesterday's Times, the leading Conservative thinker, Lord Finkelstein, advocated exactly what I have been proposing. And it seems to me that there is a growing view or growing interest in this sort of solution. If you could have an OBR for health, a process of making an independent assessment of the needs of the health and care system for funding over a given period, and if that would then inform the level of the dedicated health and care tax that you expect people to pay, shown on their pay packets, then it seems to me that we could rebuild trust in the public, and they would have the confidence that the amount that they were being asked to pay was what was necessary. It's interesting that in the German system, the social insurance premiums have actually kept pace with demand better than our tax-funded system. I think that a hypothecated tax, so that people could see exactly what was going into the health and care system, achieves the benefits of the German system, but stays true to our idea of a tax-funded health and care system. And it seems to me that with people very anxious and nervous about governments misusing their hard-earned taxes, having a process of independent assessment would make an awful lot of sense. So Can this government, Madam Deputy Speaker, not rise to the challenge of reviewing a system, as I say, designed in the 1940s, a time wholly different to the needs of today? It seems to me that we are collectively in this Parliament badly letting down the people of this country. We are the 6th largest economy in the world, and yet we have a health and care system that's on its knees, that too often is dysfunctional. I think we're capable of better than that. It undermines, it seems to me, people's faith in politics to be able to resolve the big challenges of our age. And it would increase the belief if the government simply persists in going it alone without properly addressing this. It will increase the belief that the government actually has a hidden agenda, that it wants to run the NHS down in order to destroy it. So my plea to the government is don't allow that belief in a hidden agenda to grow. Engage with us. Have a mature discussion with the public. Demonstrate a commitment to a process of renewal of this great institution, because the country, the people of this country, depend on us meeting this challenge.